This is sample audio from this product. You will receive the complete audio to stream or download after you purchase. Thank you. Hello and welcome to the 2-page cheat sheet for the NRCME presented by the DSG team. That's the DOT Study Guide team. Here we go. A CMV. A CMV is a commercial motor vehicle with a gross weight greater than 10,000 pounds, more than 10,000 pounds, or 9 to 15 passengers, including the driver for compensation, or 16 or more passengers, including the driver, regardless of compensation. And finally, it's a CMV if it transports hazardous materials in quantities requiring placarding. Medical examiners examine for medical fitness for duty, not treating any conditions. They can help the patient get the condition treated, but they are not actually doing the treatment. The role of the medical examiner is simply medical fitness for duty. Medical examiners cannot add any limitations or exceptions for drivers. And if further information is needed, a follow-up continuation of your evaluation can occur and does not require another full exam. You'll give one copy of the medical examiner's certificate to the driver and to the employer. The licensed physician responsible for receiving lab results and evaluating the explanation for drug results is the MRO, or the Medical Review Officer. A CMV driver must be 21 years old or older, speak and read English well enough to converse with the general public, and have a valid medical examiner's certificate. The 4 non-discretionary standards are vision, hearing, diabetes, and epilepsy. Vision, hearing, diabetes, and epilepsy. Vision includes these 3 things: visual acuity of greater than or equal to 20/40, peripheral vision of field of vision greater than 70 degrees, and color vision. Hearing, a 5-foot force whisper test or the audiometric testing. With audiometric testing, it must be greater than 40 decibels average for the 500 hertz, 1000 hertz, and 2000 hertz levels. And this is regardless of hearing aid use. You simply recommend that the driver carry a spare hearing aid battery, and at least one ear must pass. Diabetes that requires insulin is disqualifying, but an exemption is an option. And finally, epilepsy, this is certainly disqualifying. Now, an exemption is valid for 2 years with an annual medical and specialist examination, and then the maximum certification is for 1 year. The drivers must be advised to avoid driving within 12 hours after taking sedating medications. 12 hours after taking sedating medications. If there's an ICD, an implanted defibrillator, even if it's inactivated, this is disqualifying. Okay, we're going to round the numbers when we talk about hypertension, but just know that these are essentially these levels. So blood pressure of greater than 140/90. If they have this blood pressure, you need to confirm with a second measurement later on in the exam to make sure it's not some of that white coat syndrome from them walking in from the waiting room, etc. So here are the stages of hypertension. First of all, you should know that the systolic and the diastolic numbers, if they are in different stages, then you need to classify by the higher stage. So if systolic is stage 2 and diastolic is stage 1, you need to go with stage 2 because that's the higher of the 2. Now, if the patient has no hypertension, they can have a 2-year certification, no history of hypertension at all. Now, but if they have 1 or more antihypertensive meds that are being used for the express purpose of controlling high blood pressure, then the patient is considered to have a diagnosis of hypertension. Now, if they're using those medicines for something other than for controlling hypertension, then this does not apply. So stage 1, and again, we always recommend that if you can, try to use more than 1 supplement for your education here. So here's the audio, but I hope that you're also able to use a visual component, visual supplement product to be able to see these numbers, not just hear them, be easier to understand. Stage 1, 140 to 160 over 90 to 100 is stage 1, and that is an expiration of 1 year. You can recertify for 1 year if their blood pressure is under that magic 140/90. Now, if it's not, if it's in the 140 to 160 range over the 100 or 90 to 100 range, that will require a one-time certificate for 3 months so they can get that corrected. For stage 2, the levels are 160 to 180 over 100 to 110. 160 to 180 over 100 to 110 is stage 2. That will get a one-time certificate for 3 months. And when you recertify, it's 1 year from the date of the exam if their blood pressure is under that magic 140 over 90. Now, stage 3, this is the unacceptable risk and is disqualifying. That is more than... For more information about the other products we provide regarding the DOT exam, meaning the NRCME, please go to our website and purchase our products there. Thank you for your support. Your purchase of this and our other audio and visual products allows us to keep producing and improving the content we provide.